In this video, I'm going to talk about what a therapeutic care plan might look like for a child or young person in your care who could not safely be cared for at home. First, we need to consider the role of consistency. Consistency supports a sense of the predictability of life, including your caregiving, which is likely to be calming for the child or young person in your care. Whatever you choose to do as part of a therapeutic care plan, only start what you can maintain over time. Also, consider turning something that happens sometimes in your home into a regular thing. This will also support the child or young person in your care's sense of the predictability and consistency of life in your home. In conventional circumstances, infants learn to trust in the accessibility of their caregivers when they attend to the infant, whether they are crying or quiet. Where care has been inadequate, check in with the child or young person in your care proactively, as often as you can maintain over time. Checking in proactively supports experiences that you are there for them without them having to go to great lengths to make it so. In turn, this supports their emerging self-worth and belief in their worthiness to receive care. Thirdly, if you find yourself going to ask the child or young person in your care a question and you think you know what the answer would be should they give it, don't ask the question, say the answer. Acknowledging the child or young person's experience in this way supports their perception that you get it, that you understand them. This supports their trust in you and their own emerging belief about their self-worth. Where self-worth might be considered as having a regulating influence over their approach to life and relationships. Verbalizing understanding in this way supports expressive language development and use, thereby reducing reliance on communicating about their experience through their behaviour. Fourthly, spend a few days keeping a record of all the requests the child or young person in your care makes and which you are happy to respond to, or any behaviours that they exhibit that seem to be directed towards satisfying a need independently, especially those that you allow. If you can anticipate any of these requests or independent behaviours to satisfy a need, try attending to the need or the request proactively. That is, before they ask or even do anything to satisfy the need. Again, this supports the child or young person in your care's emerging sense of their worth and deservedness of care. And it supports their belief that they can rely upon you for needs provision without them having to resort to controlling or demanding behaviour or to being overly independent to secure a response to their needs. Fifthly, engage the child or young person in your care over an activity that you'll both enjoy. Do this regularly. This supports experiences of emotional connection that in turn support safe exploration of emotion, emotional development, empathy, and consideration of the experience of others. Lastly, keep a record of all the times that you perform an action associated with the therapeutic care plan and familiarise yourself with what recovery from a tough start to life looks like for children and young people. Unless you are thinking about these things, you are unlikely to notice them. Noticing the progression of the child or young person in your care and your own delivery of therapeutic care is likely to sustain your endeavours, including through inevitable tough times. For more information about what therapeutic care looks like, do visit my blog site, Attachment and Resilience, with the web address colbypearce.net, or visit the Secure Start website, securestart.com.au, which includes a number of self-paced learning programs which cover a range of topics related to the formulation and delivery of therapeutic care for children and young people who are recovering from a tough start to life.